Hi, my name is Maria Belengarate and I'm going to talk to you about the duodenum. The duodenum is the shortest part of the small intestine, only 10 to 12 inches long. It receives food from the stomach and passes food onto the duodenum, the second section of the small intestine. The duodenum precedes the duodenum and ileum and is the shortest part of the small intestine, where most chemical digestion takes place. The name duodenum is from the Latin duodenum digitorum, or 12 fingers breadth. The pyloric sphincter separates the stomach from the duodenum. This valve keeps food and gastric juices in the stomach until liquefied enough to proceed into the duodenum. Peristaltic waves push the chyme through the pyloric sphincter, a small spurt at a time. This process cycles until all of the food is liquefied in the stomach and proceeds to the duodenum. The partially digested food arriving from the stomach stimulates the duodenum to produce hormones. These hormones tell the pancreas to release digestive enzymes and the gallbladder to release bile. Much of the food digestion takes place in the duodenum. Digestive enzymes from the pancreas break down fats, proteins, and carbohydrates. The bile helps in the digestion and absorption of fat. Strong acid in the stomach used in food digestion could be harmful to the small intestine. In response to this acid entering the duodenum, secretin is secreted by the duodenum. Secretin stimulates the pancreas and bile ducts to release sodium bicarbonate. The sodium bicarbonate travels through the pancreatic duct to the duodenum to neutralize the acid. The duodenum also plays a major role in controlling the rate of digestion. The GIP hormone produced in the duodenum decreases the rate of stomach contractions. This slows the emptying of food from the stomach into the duodenum. This provides the small intestine with more time to digest the fats, proteins, and carbohydrates.
So from the stomach, chyme is going to enter this part of the small intestine called the duodenum. That's the first part of the small intestine. A lot happens here. First off, we're going to have bile that comes in from the gallbladder as well as from the liver, and that's going to come in contact with the chyme in the duodenum, help to break down some of those fats. We're going to have a whole plethora of enzymes and substances that come in from the pancreas. Here I have a picture of where the duodenum is in relation to the rest of your body.
Crohn's disease, a chronic inflammatory disease of the intestines, most often affects the lower part of the small intestine, the ileum, but can also affect the duodenum. Crohn's often runs in families, with 20% of people with Crohn's having a blood related with the disease. Symptoms of Crohn's include diarrhea, rectal bleeding, abdominal pain, weight loss, fevers, and joint pain, while medications such as steroids to reduce inflammation or antibiotics can help control Crohn's disease. No cure exists. Peptic ulcers affect the stomach and duodenum, with duodenal ulcers being the most common.